Hi everyone, this is Justin Vaughn with MiraMed Global Services. Our article today is entitled Proposed OPPS Rule for Fiscal Year 2021. The Centers for Medicare and Medicaid Services, or CMS, provided a press release on August 4 outlining several proposed rules that will affect the healthcare industry if approved. The following will act to summarize a few of those key proposals. This first section is entitled Telehealth Ascending. Pursuant to an executive order signed by President Trump on Tuesday entitled Improving Rural and Telehealth Access, CMS is proposing changes to expand telehealth permanently in an effort to improve access and convenience of care for Medicare beneficiaries, particularly those living in rural areas. To support its proposals, the agency provided the following historical background. First, over the last 3 years, as part of the Fostering Innovation and Rethinking Rural Health Strategies initiatives, CMS has been working to modernize Medicare by unleashing private sector innovations and improve beneficiary access to services furnished via telecommunications technology. Second, starting in 2019, Medicare began paying for virtual check-ins, meaning patients across the country can briefly connect with doctors by phone or video chat to see whether they need to come in for a visit. Third, in response to the COVID-19 pandemic, CMS moved swiftly to significantly expand payment for telehealth services and implement other flexibilities so that Medicare beneficiaries living in all areas of the country can get convenient and high-quality care from the comfort of their home while avoiding unnecessary exposure to the virus. And fourth, before the Public Health Emergency, or PHE, only 14,000 beneficiaries received a Medicare telehealth service in a week, while over 10.1 million beneficiaries have received a Medicare telehealth service during the PHE from mid-March through early July. The proposed rule would extend the availability of certain telemedicine services after the PHE ends, giving Medicare beneficiaries more ways to access health care, particularly in rural areas. During the public health emergency, CMS added 135 services such as emergency department visits, initial inpatient and nursing facility visits, and discharge day management services that can be paid when delivered by telehealth. CMS is proposing to permanently allow some of those services to be done by telehealth, including home visits for the evaluation and management of a patient, in the case where the law allows telehealth services in the patient's home, and certain types of visits for patients with cognitive impairments. CMS is also proposing to temporarily extend payment for other telehealth services, such as emergency department visits, for a specific period of time. This will also give the community time to consider whether these services should be delivered permanently through telehealth outside of the PHE. This section is entitled Revaluing Care. Last year, the Trump administration finalized charges. Let me repeat that. Last year, the Trump administration finalized changes to increase payment rates for office, outpatient, evaluation and management, or E&M visits beginning 2021, in part due to a recognition that, quote, certain chronic conditions in the Medicare population is growing, end quote. For example, as of 2018, 68.9% of beneficiaries have 2 or more chronic conditions. In this 2021 proposed rule, CMS would increase the value of many services that are comparable to or include office or outpatient visits, emergency department visits, end-stage renal disease capitated payment bundles, physical and occupational therapy evaluation services, and others. The proposed adjustments would implement certain recommendations from the American Medical Association, or the AMA, would help to ensure that CMS is appropriately recognizing the kind of care where clinicians need to spend more face-to-face time with patients, like primary care and complex or chronic disease management. The section is entitled Empowering Providers. In an effort to reduce regulatory burden for providers, CMS is proposing to make permanent some of the temporary changes it made during the PHE. The changes include, first, nurse practitioners, clinical nurse specialists, physician assistants, and certified nurse midwives, instead of only physicians, will be allowed to supervise others performing diagnostic tests consistent with state law and licensure, providing that they maintain the required relationships with supervising or collaborating physicians as required by state law. Second, pharmacists can provide services as part of the professional services of a practitioner who bills Medicare. Third, physical and occupational therapy assistants, instead of only physical and occupational therapists, may provide maintenance therapy in outpatient settings. Fourth, physical or occupational therapists, speech-language pathologists, and other clinicians who directly bill Medicare may review and verify, that is, sign and date, rather than redocument information already entered by other members of the clinical team into a patient's medical record. Public comments on the proposed rules are due by October 5, 2020. To access and review the entirety of the proposed rule, you can go to the following link, which you can look up on our website. And please reach out to us at info@mirrormedgs.com if you have questions about these proposed changes, or if we can help you with any other issue. Thank you.